Well, thank you, Mr. President, and I would like to thank you on behalf of California. Governor Newsom says the work that you're doing together has been working very closely. It's been effective in California as well, the Vice President and the President. You know, today, Mr. President, I want to thank you especially for the work that Secretary Mnuchin has done, especially for small businesses. Just today alone, I saw Bank of America had more than 10,000 loans in 2 hours. And for anybody who's in small business, I first small business when I was 20 years old. You don't have income coming in right now. You get a loan, but for your rent, paying your employees, and paying your utilities is a grant. That's part of the CARES Act. And I think you're going to find that a lot of small businesses are going to hire people back, keep them afloat through the next 2 months, and get this economy moving again as we get through this virus. So I just want to thank you for it.
Thank you, Mr. Vice President, Mr. President. Thank you for your words of discipline and determination. I guess that really describes what we're asking every American, to really be disciplined about these guidelines and really determined to stay in that space of execution. You know, we are just in week 3 of this full guidance measure. We really do appreciate the work of the citizens of California and Washington State, because we do see that their curve is different. Their curve is different from New York, New Jersey, and Connecticut. And we really believe that the work that every citizen is doing in those states is making a difference, and it will make a difference for the frontline healthcare providers. We also are deeply grateful that despite the way their curve looks today, they continue to get ready for a different potential, so that they can ensure that patients, if they do get sick, have options and availability. To all the frontline healthcare workers in what we have referred to as hot zones, areas where the number of cases are quite significant, the New Orleans, the New York City metro area, including New Jersey and Connecticut, the incredible work that the frontline healthcare workers are providing. We're really working now at a much more granular level, talking directly to hospitals to ensure that they have the supplies that they need in coordination with state and local governments. And to work, I think we discussed it yesterday, but I think it was quite clear also and reiterated by Governor Cuomo today, that we have to support one another as each of these different metro areas and other areas move through their peak of new infections. When we talked about it at the beginning of this week, we talked about this week and next week being incredibly difficult. And we want to recognize the number of Americans who have lost their lives to this virus, and recognize the sacrifice that healthcare providers are making both in their care, but I think I'm very uplifted by hearing their messages to families and their compassion for others to provide that kind of support to the individuals in the hospital. We continue to watch, in addition, the Chicago area, the Detroit area, and have some developing concerns around Colorado, the District of Columbia, and Pennsylvania. So as you can see, each of these will follow their own curves. We'll be getting more and more of those case over time information in a very granular way to each and every one of you, so that we can follow these epidemiologic curves as each of these states, counties, and communities move through this together in solidarity, and really ensuring that we can move supplies creatively around the country to meet the needs of both the frontline healthcare providers, but also every American who needs our support right now. Thank you.
Thank you very much.
Well, thank you, Mr. President, for your continued leadership as we battle the coronavirus. First, I want to thank all of the members of the HHS team and the frontline healthcare workers across America, including those service workers who serve in our hospitals and our healthcare facilities, those who clean, those who deliver, those who stock the shelves, all those who are going into battle every day against the virus. Your country's asked you to serve as never before, and you have responded heroically. I'm going to provide a brief update on the administration's plans to cover the testing and treatment for the uninsured. Getting the uninsured access to the care they need is a top priority for President Trump. We are already rolling out the $1 billion in funding from the Families First Coronavirus Response Act to cover providers' expenses for testing and diagnosing the uninsured. The CARES Act, signed by the President, includes another $100 billion for healthcare providers. Under the President's direction, we will use a portion of that funding to cover providers' costs of delivering COVID-19 care for the uninsured, sending the money to providers through the same mechanism used for testing. As a condition of receiving funds under this program, providers will be forbidden from balance billing the uninsured for the cost of their care. Providers will be reimbursed at Medicare rates. We will soon have more specifics on how the rest of the $100 billion will go to providers. We're working to ensure that this funding is distributed in a way that is fast, fair, simple, and transparent. I'd also like to remind people that if you've lost employer insurance coverage, you have insurance options that you should look into. You'd be eligible for a special enrollment period on the healthcare exchanges, and depending on your state, you may be eligible for Medicaid. Just as President Trump is working to ensure that COVID-19 treatment is paid for, he's working to support new treatment options for patients. Thanks to the President's leadership, many providers are trying different experimental therapies, and we need as much data as we can collect as quickly as possible on how these treatments are working. Today, Oracle has developed and is donating to the government and the American people a web portal and platform to gather crowdsourced real-time information from providers about how patients respond to potential therapeutics. While this doesn't replace the important work of clinical trials, it gives us data rapidly. If you are a doctor or a healthcare provider and you would like to help us, you can sign up today to begin reporting on your work. There's a special registration page for providers at covid19.oracle.com. Thank you very much.
Well, thank you, Mr. President, Mr. Vice President, Mr. Secretary, and CDC Director Redfield. I especially want to thank the folks at the CDC. And it's a great question that you ask. It's a fair question that you ask. I want to unpack the evolution of our guidance on masks because it has been confusing to the American people. First of all, I want people to understand that the CDC, the World Health Organization, my office, and most public health and health organizations and professionals originally recommended against the general public wearing masks because based on the best evidence available at the time, it was not deemed that that would have a significant impact on whether or not a healthy person wearing a mask would contract COVID-19. We have always recommended that symptomatic people wear a mask because if you're coughing, if you have a fever, if you're symptomatic, you could transmit disease to other people. What has changed in our recommendation? Well, it's important to know that we now know from recent studies that a significant portion of individuals with coronavirus lack symptoms. They're what we call asymptomatic. And that even those who eventually become pre-symptomatic, meaning that they will develop symptoms in the future, can transmit the virus to others before they show symptoms. This means that the virus can spread between people interacting in close proximity. For example, coughing, speaking, or sneezing, even if those people were not exhibiting symptoms. In light of this new evidence, CDC recommends and the task force recommends wearing cloth face coverings in public settings where other social distancing measures are difficult to maintain. These include places like grocery stores and pharmacies. We especially recommend this in areas of significant community-based transmission. It is critical, and the President mentioned this, the Vice President mentioned this. It's critical to emphasize that maintaining 6 feet of social distancing remains key to slowing the spread of the virus. But CDC is additionally advising the use of simple cloth coverings to slow the spread of the virus and to help people who may have the virus and do not know it from transmitting it to others. The cloth face coverings recommended are not surgical masks or N95 respirators. Those are critical supplies that must continue to be reserved for healthcare workers and other medical first responders as recommended by the current CDC guidance. As the President also mentioned, cloth face coverings fashioned from household items or made at home from common materials at low cost can be used as an additional voluntary public health measure. This recommendation complements and does not replace the President's coronavirus guidelines for America, 30 days to slow the spread, which remains the cornerstone of our national effort to slow the spread of the virus. CDC is always looking at the data. We've told you that from the beginning. Dr. Birx says it every single press conference. We're looking at the data, we're evolving our recommendations, and new recommendations will come as the evidence dictates. So I want to say, if you do choose to wear a face mask, very important, wash your hands first, because you don't want to put on a face covering with a dirty hand. Do not touch your face while you are wearing the face covering, because again, you could take materials from the surface, germs from the surface, and bring it to your face. If you choose to wear a face covering, please leave the N95 mask, the medical supplies for the medical professionals, healthcare workers, and frontline workers. Know that this is not a substitute for social distancing. And remember, this is all about me protecting you and you protecting me. This is about us coming together as communities, and if people voluntarily choose to wear a face covering, they're wearing it to protect their neighbors from getting the coronavirus, because again, they could have asymptomatic spread. So, Mr. President, thank you very much for that. Appreciate the opportunity to update everyone.
Go ahead, Jim.
Mr. President, you have said nobody could have seen this pandemic coming. But in fact, Secretary Azar at a biodefense summit in April 2019 said, of course, the thing that people ask, what keeps you most up at night in the biodefense world? Pandemic flu, of course. I think everyone in this room probably shares that concern. Your own Health and Human Services Secretary was aware that this had the potential of being a very big problem around the world, a pandemic of this nature. Who dropped the ball?
Actually, absolutely. For 15 years now, this country has had a massive effort at the federal, state, and local level of preparedness for pandemic. Now, that largely has been, as I said in those remarks, about pandemic flu preparedness. We knew about SARS, we knew about MERS, which were earlier modifications or variants of the coronavirus. None of those achieved anything like what we're seeing today. But that's why for successive presidencies, including the leadership of President Trump, there has been a great focus on pandemic preparedness. In fact, it was just in November, I believe, that the president signed the Pandemic Flu Preparedness Executive Order that we have also updated the Pandemic Crisis Action Plan, which has been the playbook from which we've been working, the Pandemic Flu Plan, the action plan from which we have been working that coordinates the whole of government, whole of economy approach here. So we've all been very focused on pandemic preparedness. That's what we do. But this particular strain of pandemic, who would have known this particular strain?
Distancing. First of all, and this is for yourself and Dr. Birx, what percentage of the population do we suspect to be asymptomatic at this point? Is there a way to figure that out? Seems like the antibody test might be able to assist in determining that number.
Yeah, thank you. So while we're working diligently in the midst of the crisis to make sure that the healthcare workers and everyone who is sick gets provided for, at the same time we're working on tests and assays that will be critical for surveillance. And at the same time, working on plans for what we need to do as this moves through the population and we get on the downside, which we're not there yet. And hopefully most of the states will say, like California and Washington. And then what we need to do to be prepared for fall. So all three of those things are happening simultaneously, and there's people working on each one of those work streams. The antibody piece is critical, as you described, because at this time, we can't, if we have, let's say symptomatic status is inversely related to age. And so the younger you are, the more likely you are to be asymptomatic. We have to know that because we have to know how many people have actually become infected. So when we talked about 5 days ago, I think on Monday, I called on universities to work on an ELISA-based test to test for their health workers and really get through that. At the same time, the private sector is working on tests. And what do we want those tests to be? We want those tests to be like what we use for HIV and malaria. Finger prick onto a cassette, you get a line if you're positive, and you get a control line. negative, the line isn't there, and there's the control line. That's our dream assay because it's a finger prick. In the meantime, we're not waiting, we're pushing for that. At the same time, we're asking to develop an assay, the ELISA-based assay, which requires a tube of blood. And that's why we're also talking about, could we use dried blood spots? We also put a call directly out to the military because of the Roosevelt to really test all of the sailors on the Roosevelt with an antibody test to get to this critical issue of asymptomatic and already pre-existing antibody. That would be if the first responders knew they already had it and they had protective antibody, if the nurses knew, the doctors knew, if your school teacher knew, then it's a very different dialogue. So we understand the importance of that, and we understand how important it is in relationship to understanding this epidemic. One other comment, because I know we're always saying who knew what when. I just want to make clear, there's 150 plus countries working on this collectively together. It's devastating for every single country. When we get through this, we can go back and look at what happened, where, and what does this epidemic look like. And when you get through it, then you can validate every model there is known to man. When you're in the middle of it, you have to concentrate on serving the needs of each American and what that need looks like. At the same time, you have these other work streams on surveillance and how to be prepared both scientifically and therapeutically and vaccine-wise for the next fall if that happens again. So I think these things are happening together, but I just want us to really concentrate on the fact that all around the globe, country after country is dealing with this. And we can talk about why didn't Italy do something, or Spain do something, or Germany do something, or we can really say right now, we all can do something. We can do the social distancing and all of the pieces that we know is starting to work around the globe in country after country. And then when we get through all of this, we can ask the questions about, could we have done some piece of this better as a global community? I will remind you that on February 3rd, the head of the WHO said there was no reason to ever do a travel ban. You know, it wasn't until January 14th that we knew that there was human-to-human transmission.
Thank you, Mr. President. This is for you and Secretary Azar. 10 million people say they've lost their jobs in the past 2 weeks. So how is this stimulus money for free treatment going to absorb the new numbers of uninsured? And would it not be easier to reopen the Obamacare markets or expand Medicaid?
So for an individual who had employer insurance, that's what I mentioned in my remarks, if you were employed and had insurance through your employer and you've now lost your job and lost that insurance, you now do have a special enrollment period where you may enroll in the individual exchanges of the Affordable Care Act. So that's existing law. Then what we're doing is taking from that $100 billion to providers, taking money and saying, if you're a provider and you care for anybody who's uninsured, we're going to compensate you for doing that. And we're going to compensate you at the Medicare reimbursement rates, and you are not allowed to bill that uninsured individual anything. So in many respects, it's better for those uninsured individuals. They're going to get first dollar coverage, they're going to get care in the United States, and the provider's going to be made whole from this program. So it's really an unprecedented, what President Trump is doing here with this money is an unprecedented disease-specific support of care for individuals to make sure that people get treatment.
Thank you very much. I think I just want to reemphasize, I've said this before, that we're not defenseless against this virus. We have a powerful tool, a powerful weapon, that is social distancing. And we've continued to embrace that with the President's initiative to slow the spread of coronavirus. We're constantly looking at new data. And as the Surgeon General said, one of the new information that became more clear to all of us is there's a greater number of people that are asymptomatically infected than we previously thought. And as Ambassador Birx said, that may be inversely related to age. And so really the purpose here is first and foremost to embrace the social distancing. That's the number one thing. That's the powerful weapon. And you know, this virus has a great weakness. It can't jump from one person to another if it's got to swim more than 6 feet. And this is why we really want that. That said, we now know that there may be individuals in areas of significant community transmission that may be asymptomatically infected. And we know that a face barrier can actually interrupt the number of virus particles that can go from one person to the other. So as was said by the Vice President, and the President, the purpose of this face covering is to be another adjunctive mitigation strategy to protect someone from spreading the virus from themselves to someone else.
The death toll projections that you shared with us earlier this week, are we still on the current trajectory for that, or have...
So a lot of the projections you can see are based on, there's many different ways to look at this. And as we discussed on Sunday, some of it is based on the current global experience. We're about, I think, 6.5 or 5.5 times the size of Italy, a different factor in Spain. And we look at all of those, what their projections are, where they are currently, and where that is going. And so a lot of the work is based on how this virus has moved through other populations. That's a very direct way to see how the virus is impacting a population. There's also terrific models. And so every day and every night, one of the models that actually looks at the model related to mortality is the healthdata.org data. And they update it every night, and you can see where we are in that projection. I think in the last run of that model, they were at 93,000 or something in the model. Now, all of that can be changed by our behaviors. And so, and all of it can be changed in a different way if we don't follow those behaviors. If another major metropolitan area ends up having an epidemic like the New York metro area, that could dramatically change not the model, but the reality of the impact of this virus on Americans.